Many thanks for staying tuned on the program. Recently, the National Agency for Food and Drug Administration and Control, NAFDAC, intensified its enforcement efforts against the sale of illicit and counterfeit pharmaceuticals, sealing over 3,000 shops within the Idumota open drug market in Lagos in the first week of operations. So this was made known in a statement shared on X on Saturday by NAFDAC. Well, during the raid, officials uncovered alarming violations, including vaccines stored in dilapidated, unventilated rooms, sealed with iron sheets, posing severe health risks. Now, in situations where these illegal operators go undetected, knowing Lagos as a commercial hub, these drugs inevitably get to find their way, pushed to different sections of the country, including the Niger Delta region, causing untold health hazards to innocent Nigerians. There surely have to be ways to address these inherent concerns. Well, joining us to explore some of the ways to solve this bane of operations in the health sector, especially when it comes to pharmaceutical products, is the Chairman, Association of Community Pharmacists of Nigeria, Akwa Ibom State Branch, Pharmacist Tony Anderson. Pharmacist, you're welcome on the program.
Good afternoon, viewers. Welcome to today's discussion.
Thank you for joining us.
Thank you.
Well, the issues around fake pharmaceuticals and counterfeit drugs has been around with us for a while, and it is a conversation that indeed needs to draw the much needed responses, not just from government alone, but from individuals and stakeholders who know what it means for a syndicate of this nature to be operating and the health hazards that accompany events of this nature. Now, let's appraise the whole issue generally. What is the genesis of this problem, and to what extent has it been able to be tackled effectively?
Well, the major problem is the continuous existence of the open market, because they have an enabling environment where they can hide under and carry out all of this illicit crime. It should be recorded that as of 2005, the federal government made a proclamation that all open drug markets in Idumota, in Kano, in Onitsha, in Aba should all be closed down. Why they did that was because that is where the problem lies. Don't forget, the famous NAFDAC Director General, late Dora Akunyili, tried fighting these people so much that at some point she was shot almost on the head, if not for the stuff she weighed on her head that gave her that protection. And so if we don't, what is happening now, I've always said, is treating the symptoms. You cannot still allow them to open in a place to operate in a place you cannot regulate them, and what you do is once in a while you go in to raid them. Now, as of 2005, that pronouncement was made. They now gave deadline 9 years after 2014. Today is 2025. They are still there. Now, the problem is, why is the open market still where they are? Because that is where all these things happen. I'm not saying all the people trading in the open market are all corrupt, but a greater number of them. In Akwa Ibom, for instance, as of December, we decided to mop up about drugs worth over 460 million, and I, confiscated it to NAFDAC for burning. It's because we have pressures from outsiders wanting to buy those products. The way people coming in, they have canvassers, it's a cartel. Like the one of those videos in Aba, in a 2-story building where they keep what they do is buy all expired drugs and go to counterfeit the date and send it back. People may be listening to it and feel it's an Aba issue. That thing they do, they spread within and outside the country. Because Aba is a hub. People, they will send it to customers in Lagos, in Kano, and it gets to everywhere. So when one illegal factory of counterfeiting exists, it puts the whole nation at risk. And so the best way, or the way to do this, is that the government have to be deliberate and intentional. They must be able to pull off the open market and have coordinated wholesale centers. By the time they do that, you'll be able to regulate them. They have done this road and they will go. The traders, they will look at their modus operandi and they are going to re-strategize And they are going to continue because counterfeit and fake drug is not something of today. It's been there for so many decades. How come the government cannot put an end to this? And people's lives are at risk. People are having a lot of treatment failure. You get to the hospital and you're coming back worse than you went. People are having a lot of challenges in their health. Some of them is because of counterfeit drugs. And then when they are saying they want to establish this law, that law, the first thing is to tackle the open market. If you're able to close them down and now generate coordinated wholesale centers, let it be people you can control. Like now, who have the data of the people in that open market? There are so many. I don't know if you visited the open market where they sell these drugs. There's a case of vaccine they saw in a building. I have visited Idumota, just sightseeing around November, and I saw oxytocin in the sun. Wow. That's a drug that should be stored between 2 to 8 degrees Celsius. And that is what a delivery mother needs. And they go in there, they inject oxytocin, it fails every time it sears. Meanwhile, the oxytocin they are using is not working, it's already denatured.
What is the role of these open markets and is it related to the different chemists or pharmacies that we see around?
No, it's not. Open market is cluster. You know, the Niger, for instance, is one of the biggest open market in Africa. If you go to an open market, you get lost. That drug market, you enter, the place is too large. It's too massive. It's a system where maybe I own a shop there. I bring in people, train them. After 10 years, settle them, they open. So they keep spreading by the month because new people are coming, that are just coming to serve, kind of. Most of them are not well trained. Most of them will come to do what their masters were doing. If their master were
or even do better than the master.
Or do better. So they will copy what they see.
Yeah.
And now the government is unable to regulate them because of their number. Because of their number. In an open market like in Onitsha, you could have over 20,000 shops there.
But the operators, are they not registered with a particular body? So why should there be a problem of regulation? They are not
registered. You can't control them. Do you know who and who is there? It's dependent on their masters. I have 10 people undergoing tutelage with me, and when they are done, I settle them. How are they able to regulate them? Does the federal government or the government even know the number of shops that are there? They don't have any data.
There surely has to be a way to go around this.
The way out of it is to shut them down, then open a coordinated center, a wholesale coordinated center where every shop is well labeled. You know that this pharmacist is here, this one is here. So by the time you have the data, you'll be able to control them first when you know who they are. The problem, let's go to this. But the way that market is, like this building now, I can restructure it and turn this 4 more outlets. Just do this. So,
okay, now
that is why you have, when you talk, like, take for instance, some years back, codeine was banned.
True.
There are so many drugs that are banned. But go to the open market, you see codeine there. Display. It's only in the open market they do it because of the way the open market is. The people, if they are coming in from the gate, they have signals. Because it's too wide. It's all like one close that you could tackle and then, investigate them. In the market, most of them don't even have shops. They have where they keep this thing when you need the go and breathe. So one way problem is not to treat the symptoms. What is happening now is treating the symptoms. They've always been reading them.
Okay.
But one way of having a permanent solution to it is to close the open market. There must be an alternative. Then have a coordinated wholesale center. And in 2015, July 1st, the federal government pronounced that 214 they gave today. They keep giving dates. They keep announcing. The federal government, the government at all levels have seen the need to close it. But I do not know why they cannot close it. Don't forget, most of these people in the open market are the richest men. You have billionaires there, millionaires there. So I do not know what interplays that after saying they will be closed down, they are still here and even beyond today. And what we'll keep doing is to raid them and raid them. When you go, you just discover 1% of what is happening there. Because you are not there with them to see what is happening. How many are the NAFDAC staff? The NAFTA Director General is just one. They go as a team. They go here, work for 2 weeks. By the time you go back, they re-strategize and continue their thing. Who are the people suffering? The Nigerians that are consuming this counterfeit.
Okay, so these open market operators, now let's get it clear. Are they just distributors or they are manufacturers as well?
They are not manufacturers. They are just merchants. Some of them are importers.
Okay.
Don't forget it has level tiers. The
supply
importers
chain
will bring in, and then you have those that buy from the importers to sell. Then, because of their crowded nature, view a market the way a market is. What you see in a market is it well structured?
No, it's not.
Yes, it's not well structured. You can't have an absolute control, and when it comes to things like drugs, there's a need to control it absolutely. Okay. You must know what, like for instance, storage. Do they have electricity in that market?
No, like you said, iron barred containers. That's where some vaccines were being stored.
Yes, meanwhile, that vaccine needs 2 to 8 degrees Celsius. Otherwise, it becomes denatured.
Okay.
And you have an issue and you want to take maybe insulin, for instance, for the diabetics. And they have gone to buy it from the open market. You buy something that's been denatured already, and when you buy, you come to store it in the refrigerator. That's like storing a spoiled food. You get a spoiled food. And
is it within this scenario that counterfeiting also takes place?
Yes, of course. When we talk of...
They're also responsible for counterfeiting.
Yes, counterfeiting. Counterfeiting is, for instance, there are so many ways of counterfeiting drugs. One of the ways is to counterfeit the expiry date.
Expiry date to change.
Maybe a drug that has expired, say, 223. On the 3, they change all the 3 to 8. It becomes 228. Sometimes, another way of counterfeiting and fake drug is to produce drugs that looks like the original. What they do is they just get the label. Okay. Maybe there's a drug that is in demand and everybody is, seeking for that drug. They get a label and package whatever that looks like it and stamp it. When you look at it, you cannot even differentiate. Okay,
so on the part of the consumers,
yes.
On the part of the consumers, is it not possible for the use of technology, like you have some vial detectors for vaccines and a code where you text a number to?
Yeah, but those things. Malarias in some years past, there used to be code number you can send, but those things are no more there. If you buy those codes are no more being used because it wasn't still effective. It wasn't still effective.
So why was that not effective?
I don't know. Okay, let's say you have those codes even where there are network issues because it works on network. So it wasn't a generalized effective method, and those codes were failing too, because of those internet service providers and all of that. Because I knew in my practice we used it, but after a while the companies were not putting that code anymore in the anti-malaria. But all of that is still treating symptoms. What we need to do is to be very realistic in our approaches. One of the ways to shut down the open market, as soon as that is done, 95% of this problem is solved. Because in as much as the open market are there, they will always find a way of introducing these counterfeit and fake drugs and then circulate because they are the highest buyers.
Okay. Well, we know that there's been the conversation around soaring cost of medications for a while now, and it has continued to be a real-time concern for Nigerians. Now, to what extent would you say that this has a role to play in what's happening within the pharmaceuticals and the issue of fake drugs and counterfeiting?
Yeah, but of course, we know why most of the drugs have been increasing in prices. Most of the pharmaceutical companies are also leaving the country. Like GlaxoSmithKline left last year, having been here for 51 years. Their products became very scarce and very expensive. If you know things like Ventolin, inhaler, Piclos, and all of that, that we used to sell about 600 naira a card. At some point, the card was getting almost to 10,000. That was artificial scarcity because GlaxoSmithKline left. Okay. They are not the only ones that have left, but they are the ones that left and it made news headlines. So many others have left too. And then don't forget that most of the drugs we use and consume here are imported. And then with dollar increasing every day, it is expected that those drugs will also increase because they need to source them from the outside. that comes to the point that the government should look at how we could also produce these drugs locally, because we are having over-dependent on foreign drugs where we need to use dollar in buying them. And even those that are produced here, they need to buy active ingredient there. For the counterfeiting drug, it has always been there. It's more like a business to those people. True. Even when drugs were not this expensive, that is a trade on its own. There are some people that is their own line of business, to counterfeit, to sell fake drugs. Because let's take, for instance, a drug that goes for 10,000, and they bring the counterfeit that they have not spent, maybe just mere excipient starch that is in that drug. Okay. They just label it, and the production cost is not up to 1,000, because this other one, the market value is 10,000, and they sell it 7,000. They are far richer than the people selling the real thing because of their profit margin. Exactly. And so it's greed and indiscipline that leads it, or leads people to, indulge in such practices. They are the richest. They have more money. You that is selling 10,000, your profit may just be 1,000, for instance. And somebody is having his own production cost at 1.5, which is fake, but looking like the original thing, and decide to sell it 7,000. And people like cheap things. They go to buy them. They go to patronize them. The person selling this cheap thing is reaping off more profit. It will sell even more volume because of its low cost. Okay. So, cost of medication.
Okay. So while we wait for the federal government to act on shutting down the open market, like you said, is it possible for public enlightenment where we encourage consumers to only patronize hospitals that carry out e-digital prescription, where they only buy from verified manufacturers? Would that also help in driving these people out of market?
The hospitals are the ones that buy most at the open market now.
Oh my God.
What? They have to. If you want to buy your drugs, buy it from trusted pharmacy outlets. Trusted pharmacy outlets that you know. Because there are people that will never indulge in those counterfeits. Yeah. Yes, so you must be sure that where you are buying is well organized, and then, they have that history of not, getting indulging in such practices.
But the hospitals could be regulated to make sure they patronize only these pharmacies.
Hospitals will want to buy very cheap drugs, so most times they patronize the open market.
Well, Pharmacist Anderson, we know that the issues on ground are real, but then there are roles of states that can be played in ensuring that these issues are addressed. Now, back in 2023, I think the Akwa Ibom State House of Assembly had put out a task force, or reactivated a task force.
The last task force, and I've always been saying it as an advocacy kind of anytime I have the opportunity. The last task force we had in Akwa Ibom was during Victor Atta's regime. And it was very effective because in the state, we were able to control and make sure we mopped out, fish out the people that were trading in this illegal trade. But since after Victor Atta, there have really been no task force. In fact, there is no task force. We've always been glamoring for it, advocating for it. But till date, I can tell you that there is no task force in the state.
So what happened to the one that was announced in 2023? By the House of Assembly.
Where is it?
It was supposed to regulate pharmaceuticals or fake drugs in the state.
That's what I'm saying, that it's not in existence.
So what are the steps that you would suggest should be taken, at least at the interim, in ensuring that these issues that we are talking about are addressed?
Every state should have a state task force that helps monitor, because NAFDAC does not have that personnel and that capacity to be everywhere. So state task force, as soon as the state task force comes, like we had before, the task force we had before now was very effective in mitigating some of these vices. And so the emphasis there is that states should establish state task force to help NAFDAC in this monitoring.
You see a role that interagency collaborations can play in this? For instance, the NDLEA, do you think they have roles to play in ensuring that?
The NDLEA is established mostly for narcotics.
But
narcotics.
You talked about shortage in workforce. Is there a way they can?
Yeah, but the narcotic they are doing is also a heavy tax. Don't forget, for NDLEA, theirs goes beyond medicine. They regulate drugs. And you know that all medicine are drugs, but all drugs are not medicine.
True.
So their own cannabis are there, most of these drugs on the street. So they have an enormous tax already to do than to now come into medicine. For this counterfeit drug, it lies within the portfolio of NAFDAC to control. Now, NDLEA is to do narcotic, which is not just medicine, but drugs.
So how do they get the needed support? Because you mentioned shortage. So how do they get the needed support? Local recruitments?
Not local recruitment. Like I said, why they strengthen NAFDAC, they should think of shutting down the open market. Why strengthening NAFDAC? Because that's the way to solve the problem. Others are treating the symptoms. For instance, there are so many regulatory bodies, like the Pharmacy Council of Nigeria. They have a role to play. You need to strengthen them. But the Pharmacy Council of Nigeria, the whole of 2024, they were not even paid salary because the government didn't budget them. They said they should be funding for themselves. And recently, the government is trying to bring out another regulatory agency called the Pharmaceutical Technology, something that is not seen anywhere in the globe, in the world. That kind of duplication is a mere waste of funds. Is there and you've not finished regulating or funding rather the Pharmacy Council, you're trying to bring out another regulator that should be under the Pharmacy Council and be doing similar tasks. And so you find out that government policies should be well outlined. Pharmacy Council is there, empower them, employ more staff. NAFDAC is there, employ them, give them more vehicles. Like the NAFDAC in your office, I think they have just one operational vehicle to cover the whole state. And last year, even the NAFDAC went on strike. For 1 month, they were on strike. Those kind of agencies shouldn't go to strike.
So as we begin to wind down the conversation, Anderson, 4.7 billion naira, that is what was raided by NAFDAC in Rivers State recently. And
no, it was not raided.
They confiscated things.
Yeah, and they bonded.
4.7 billion. That is just one state. One state.
Yes.
Now, if you imagine the ripple effect this can have in other states where these incidences have gone undetected, you would see that these people are making a whole lot of money that,
of course,
at the expense of Nigerians and their health well-being.
Yeah, correct.
Would you say that it is possible that this war can be won?
It could be won if the government is intentional and deliberate about winning it. If they want to win it, in fact, there is no problem in the country that cannot be solved if the government wants to solve it.
Okay.
So it means that they are really unseen forces or hands that are preventing.
When you are fighting against billionaires, anything could happen.
The money fights you.
Yeah, the money fights back.
Well, it is really an interesting conversation we're having here. Thank you very much, Pharmacist Anderson, for making up time to speak on Niger Delta today on these pertinent issues. And it's just like you've said, we hope that these open markets, the government would see the need to ensure that it walks the talk and brings some sort of respite, especially with the issues the Nigerians are grappling with. We talk about the health hazards and all of the issues accompanying these issues.
Yes, the government intention was since 2005 to shut them down, and this is 2025. 20 years after, later, those guys are still there. 20 years.
It's a real
look
problem.
Forward to that happening.
Thank you. Thank you for having me.
Chairman, Association of Community Pharmacists of Nigeria, Kwara State Branch, Pharmacist Tony Anderson. It was good to have you on the program.
Thank you for having me.
We appreciate your time,
Thank
sir.
you.
Well, that's the size of Niger Delta today. Many thanks for staying tuned on the program. We'll see you again tomorrow. My name is Xavier Robert.
It's like you were not done talking. I am Ara Sogane Ebo. Thank you for being with us.